forward with immense respect, now call upon Dr. Santosh, Dr. Srinivas Murki, Dr. Padmaja Yelishetty to please grace the stage. Thank you, everyone. I now call upon Dr. Srinivas Murki to introduce Sushena Health Foundation and its activities. Sir, please.
So good morning, everyone, and we from Sushena Health Foundation wholeheartedly thank all of you for coming to LAMBCON 24 and making it such a huge success. Sushena was started in the year 2017, and we didn't imagine we'll grow to this level. So this Sushena Health Foundation is a small organization. We started with a group of individuals, and then we started getting more and more additions. And today we are more than 50 members in the core group and in the board and other members of Sushena Health Foundation. So we started with thinking that we'll start a comprehensive lactation management center at Nilofer Hospital. And that was our first venture. We started at Nilofer Hospital in 2017, and today it is one of the largest CLMC in the country, catering to all the premature babies in the SNCUs, NICUs of Nilofer. We provide nearly 1 liter of milk for the babies in the NICU every day, supporting nearly 20 babies with donor milk, pasteurized donor milk. Apart from that, around 400 to 500 of milk is expressed by the mothers in the milk bank, and they take the milk for their babies. So that is why we say that we are more of a CLMC. 33% of milk is given for the babies by the mothers who come there. Another 20 mothers come every day to manage the lactation problems or lactation issues. And all the team in the Sushena or in Datri Milk Bank go to the wards of Nilofer to take care of kangaroo mother care, promote breastfeeding, and also promote mother's own milk. So overall, I think we have been able to convert the largest pediatric hospital in the country into a milk-free NICU and SNCU. So that is where we started, and we are very happy with it. Then the need increased, and we started working more. So we have a comprehensive lactation management center at Kakinada now. We have another one at Gorakhpur. So we have 3 CLMCs running across the country. We have also got LMUs at Gandhi Hospital and also at ESI Hospital. One other addition which happened with Gandhi and Nilofer was adding Arya Janani. So we realized that we need to work from the fetal side and from the mother. So we had a close collaboration with Ramakrishna Mutt, where Dr. Anupama leads the show, and we have tied up with her and Ramakrishna Mutt for carrying out Arya Janani program. So both at Gandhi and ESI Hospital, we also do LMU and Arya Janani program. Then we also have CLMCs we work on build, operate and transfer model. So we'll help to start CLMCs in the units. We help them in financing, we build them, we operate them, and after 2 years, we give it back to the units to run by themselves. So we've done this in Bhopal and Indore. So Bhopal and Indore no more with us, but have been developed by us. We also have CLMCs coming up in Bhimavaram, in Noida, and so this is about CLMCs and LMUs. So we realized that we cannot work only on feeding or lactation or milk banking. So we're moving little more. We want to give wholehearted support for our babies. So we also started doing more than what we are doing so far. So we are tied up with UNICEF now to start developmental supportive care centers in Bangalore. So we thank UNICEF for tying up with us. They have been very instrumental in helping us even in many of our CLMCs. So we also worked with government of Telangana in training the lactation nurses at Warangal, Khammam. So we have trained more than 150 lactation nursing staff in these milk banks and CLMCs. So we are moving from just CLMCs to a spectrum. We have RA Janini to cater to the mother and the fetus. We have got CLMCs and then the developmental supportive care. And very recently we have tied up with Food for Soldiers to start training program for screening of retinopathy of prematurity. This is a funded program which we tied up with Food for Soldiers, and we are running that in Aurangabad and Nagpur. So we didn't imagine that we'll be able to do so much in such a short time, but thanks to all the supporting bodies, organizations, hospitals, units, NGO staff, corporates, and also many benevolent people. We are very thankful to Dr. Durga Prasad ji, who has tied up Sushena with many corporates, helping us to get the fundings. And LAMBCON also has come out of the genesis of Sushena to help in our activities of CLMCs, milk banks, RA Janini, and also the developmental supportive care and ROPs. So each one of you who have come and attended this program has become part of Sushena now. You have donated money rather than registered for this conference. So big round of applause to all of you, because whatever you have done today, whatever you have contributed is going to help one or two babies in directly or indirectly. Thank you all of you for giving us this opportunity and leading the way for making Sushena to come up much more stronger and much more bigger. Thank you.
Thank you so much, sir, for introducing us to Sushena's foundation and its activities. It was a pleasure listening from you, sir.
I take pride in calling upon Dr. Santosh Karleti to get us all acquainted with Sri Dr. Sudarshan Reddy ji.
So, very good afternoon to all of you. A big round of applause to all of you for being here. Just look at the hall, it is brimming with energy. The hall is full. This was possible because in 2012-13, when we were working on a very important initiative called the Quality Improvement Program Initiative, called the Safe Care Saving Lives. We met many stalwarts of neonatology, obstetrics, pediatrics. At that point of time, Dr. Sudarshan Reddy sir was the, just phasing out as the superintendent of Nilofer Hospital. We went to his clinic, which is there in Khairatabad. I know many of you would have gone there. Many of your children would have gone there. Probably you as a child would have also gone there. He would have seen you. On his prescription, first thing after writing RHs, he would write 1 and then breastfeeding. Without writing a medicine, first thing he would write is breastfeeding. And in a very nice Telangana colloquial slang, he would say, Emamma, ఏనుగులు ఆవులు గోవులు అన్ని పాలిస్తుంటే మనం మాత్రం బాటిల్ పట్టాలా అని he used to say in Telugu, in our Telangana slang. And then the second point would be he will draw a bottle and put a red pen on that, red mark, cross. We discussed many things with Dr. Sudarshan Reddy sir, and he said that he belonged to a village in Mehboob-Nagar district, erstwhile Mehboob-Nagar district. His father's mother passed away soon after giving delivery. Maternal mortality was high in those days in Mehboob-Nagar district. And we know that after his mother passed away due to postpartum hemorrhage, is what he said, that his father did not have a mother. So who breastfed his father? He said more than 20 mothers in the village breastfed my father, is what Dr. Sudarshan Reddy sir told. 20 mothers. And he told one more thing. You know, my father was the first graduate in my village, and the reason for that is because my father was breastfed by 20 mothers. These were some of the very, very important, spiritually oriented things that he ingrained in our minds when we were visiting him. And he inspired us so much that Sushena Health Foundation could not have a better founding president than Dr. Sudarshan Reddy sir. No better founding president. I know he is blessing us from the heavens. He had many, many opportunities in different portfolios. And wherever he went, as an administrator, as a clinician, as a practitioner, as a teacher, I think breastfeeding was on top of his agenda. I just don't want to read his, can you go to the next slide, his, whatever biodata. But one of the important things that I foresee is that he was instrumental in ensuring that Nilofer Hospital has a milk bank and a comprehensive lactation management center. And he spoke to Dr. Suresh Kumar sir, he spoke to Dr. Arun Singh sir, and Dr. Arun Singh, when he visited, he invited all the team that we must have the CLMC at Nilofer Hospital. And he will live forever for contributing to the cause of breastfeeding and lactation management. So this is how, in a very small way, we are trying to remember the contribution of Dr. Sudarshan Reddy sir. A big round of applause for wherever he is. We'll all stay in silence for a minute for Dr. Sudarshan Reddy sir. May I request all of you to kindly stand up. Let's close our eyes. Let's say Om 3 times. Om. 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 Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vasishyate. Om Shanti Shanti Shanti. Thank you. Please take your seats.
Thank you so much, sir. I now request Dr. Padmaja Elishetty to please introduce Kushwaha, sir. Ma'am, please.
A warm welcome to Professor Kushwaha, sir. We're very, very happy to have you with us. It's indeed an honor and a pleasure. No matter what I talk about, you will be very less, but just to give a brief introduction, I'd like to introduce you. You've made significant contribution in fields of viral encephalitis, adolescent health, infant and young child feeding, since the year 1977 in Gorakhpur. You've been instrumental in identifying the Japanese encephalitis as a leading cause of morbidity. And your efforts have actually contributed to the management protocols and have reduced the mortality rates. And recently, your collaborations have highlighted the role of enteroviruses in acute encephalitis syndrome, which actually led to the initiatives from the health authorities which have prevented these diseases. You've also helped the adolescent girls, about 0.4 million of them, in the years from the year 2001 to 2006 in Gorakhpur. And you spearheaded the comprehensive health and nutrition projects. You've emphasized about the reproductive health, immunization and iron supplementation, etc. And additionally, your work in infant and young child feeding has made a lasting impact both in medical colleges and community levels, and notably through the comprehensive project in Lalitpur in Uttar Pradesh. Your commitment to training and capacity building has reflected in the 9 national counseling training courses that you've conducted since 1998, which have actually equipped the hundreds of faculty members and healthcare workers, which in turn have impacted millions and millions and millions of people in the 17 Indian states, and not just you restricted to India, but you've also helped neighboring countries like Bhutan, Nepal, China, Indonesia, etc. We firmly believe that it's through your advocacy and education efforts that you have significantly advanced the field of maternal and child health, and making you a very, 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 I can't emphasize how many, very deserving recipient of this award in the honor of our beloved Dr. Sudarshan Reddy sir. Call upon you now.
I request all of you, Dr. Khushwaha sir has come all the way from Gorakhpur, and especially to address all of us for this August Dr. Sudarshan Reddy sir award, Oration. And sir has made every hospital where he worked formula free. So please, let's listen to him. Each word of his is worth gold. So let's all be very, very attentive for this oration.
Thank you so much, Dr. Santosh. It's a great pleasure to be here to deliver this prestigious oration in the memory of P. Sudarshan Reddy, who was a wonderful pediatrician, a nice human being, and kind social worker. Thanks to Sushena Health Foundation for their invitation. And now I request you all to just close your eyes for a few seconds and think what I am saying. Just close your eyes. Imagine a world where every baby gets the opportunity to thrive to her or his fullest genetic potential, where foundation of health begins not in the newborn units, but with the first simple act of skin to skin on mother's bare chest and mother's nurturing a life through breastfeeding. Imagine a imagine babies developing during the first 6 months without diarrhea, without sepsis, without undernutrition, without pneumonia. You all know that undernutrition sets in the first 6 months of life. Serious illnesses, and later when he grows older, fewer allergies, diabetes and hypertension and cancer. Most of these babies have acquired higher learning and social abilities. Imagine fewer mothers dying of breast cancer. Now please open your eyes. Good evening, everyone. Now come out of imagination. Think what is the state now. How many babies we have been learning since morning who are being born in hospital or given skin to skin or initiated breastfeeding. So you see, we have been reading since morning that the status is not satisfactory. I invite you now to a journey with me through the remarkable world of breastfeeding. A journey that not only sustains health and nutrition of children, but also empowers mothers and strengthens communities. First, I will start with the difficult situation I have seen As a pediatric student during 1979 to 1982, I observed large number of newborns in my hospital and infants dying due to sepsis, diarrhea, undernutrition, pneumonia as a result of artificial feeding, bottle feeding. I did not know how to help these babies and mothers. I myself used to feed babies with infant formula and animal milk when the mother was unable to breastfeed in postnatal ward. Myself, I have bottle-fed babies in postnatal ward. When a mother was sick, and because formula science was much developed at that time, you see, formula science developed mostly during 1940 to 1960. It was rampant and it was available everywhere. And it was killing children, and at that time I used to see 10-20 babies dying per day because of formula feeding in a large hospital with 150 newborns admissions in a newborn unit. So that was so painful for me. I read all textbooks. They have no information about how to help these mothers and these babies. At that time, it was a horrible situation. Guidelines were not clear. Though WHO adopted International Code of Marketing of Breast Milk Substitutes in 1981 and came first set of guideline in 1983, which had recommendation of breastfeeding, you can imagine, just for 3 to 4 months. The science was so poor at that time that the recommendation was breastfeeding, exclusive breastfeeding for 3 to 4 months. And the definition of exclusive breastfeeding was not clear. You see, I was surprised that to know that first slide, please. This is a great saying. Contrary to a popular belief, attaching the baby on the breast is not an ability with which a mother is born. None of the mother is born with the ability to attach a baby at breast. It is rather learned skills which she must acquire by observing and experiencing. That comes through education and training. So, you see that the Cooper's, this is the Dr. Cooper. He discovered lactiferous cyanuses in 1840, way back 1840. He died in 1840. He published this paper on breast anatomy and then he died. He has made such a marvelous picture of lactiferous cyanuses, you can see. And this structure, was so important, none of people at that time just gave attention to this anatomy, that how the babies should breastfeed. And companies, you see, they were so fast that they introduced an alternative feed to the babies. Edward Cobo was first, he was one pediatrician who discovered neurohypophyseal hormone release during human lactation in 1967. In 1967, his paper was published that oxytocin and prolactin, they have a role in lactation. And A.S. Neely had published release of oxytocin and prolactin in response to sucking in 1983. But even after these 2-3 papers, which are good papers, the knowledge on breastfeeding was not enough to help, how to help those mothers to breastfeed. Then I just, you see, I was having this inquiry in my mind how to get equipped with breastfeeding knowledge. During 1991, I got a call from a pediatrician, a saint, a Mahatma, Dr. R.K. Anand, for attending a trainer's training in recent advances on human lactation and management in Wardha. I had no money to book a train ticket. But on his instigation, I put myself on the train and went to Sevagram, and then journey begins. From that training, which was not a structural training, the BPNI was born. This course was conducted by Felicity Savage King, who was chief of WHO Child and Adolescent Development Department, and Helen Armstrong, which was chief of Nutrition Unicef Newark. After this training, I organized a training course in Gorakhpur for 4 days from my own pocket. And then BP and I started training courses in different states in India for 5 days. In 1995, Helen took me to Sri Lanka as a co-trainer to train health workers, doctors in Sri Lanka who were working with the government. After this training, Helen recommended, this training was 12 days training. Helen recommended that Dr. Kushwaha should attend, UNICEF should sponsor his training for 4 weeks in London. Institute of Child Health London used to arrange training course on human lactation, breastfeeding, counseling, practice and policy for 4 weeks. So Helen recommended, but anyhow UNICEF did not support it at that time. But I have a call from Felicity that please come and join the course. The call came on 29th June. The course was starting on the 1st July. And she said that no, nothing, you just book a ticket, come to London. I had luckily passport and visa. I went to London and I attended this 4 weeks training course. After this training course, we have a training course in India, which was an international training course. Felix herself, Felicity Savage King, I call her Felix. So she came herself in India, in Delhi, and we have international training course on breastfeeding counseling. During that course, I said to Felix that complementary feeding is also very important. Why not to have a module on complementary feeding? Felix said, just you go with that. So I made a module on complementary feeding. So we have a combined course on breastfeeding and complementary feeding counseling during 1998 in Delhi. And after that course, Felix recommended WHO and UNICEF that Dr. Kushwaha should lead training in Southeast Asia and in India as a whole. Then we started thinking about training national trainers. So I arranged 2 training courses in Gorakhpur with the help of UNICEF from 1999 to 2000, where we have participants from all over country and from adjoining countries like Bangladesh and Maldives and Pakistan. But it was difficult to travel to Gorakhpur at that time, and therefore it was decided after these 2 training courses that let us move to Delhi, make a base in Delhi so that all countries they are coming and attending training courses in Delhi. So in 2001, Dr. Faridi, who was trained in Gorakhpur, he said that I will offer services for training in Delhi. So we started training in Delhi, and in Delhi, what we did that we included another counseling in this course, HIV and infant feeding counseling. So now we have 3 courses, breastfeeding counseling, complementary feeding counseling, and HIV and infant feeding counseling, a combined course. And this course we started in Delhi, where participants from all adjoining countries and India participated. Then I thought that let us have some other parameters also. So I have devised this course, the counseling course, which is for 2 weeks. We have been talking and discussing and making chapters, and then we wrote a module for training for 2 weeks for doctors, for faculty members, medical colleges, nursing colleges, and nutrition colleges, faculty members. We wrote this training module. And this training module we started first time in 2006 from Jaipur, then we went to Hindupur, and then we started moving to different places for training. So we have just conducted training course in Bangalore, then we have a training course in Chhattisgarh, then we have in AIMS Delhi, then we have Jodhpur Rajasthan, then we have in Simla, then we have in Patna Bihar, then we have Rajiv Gandhi Hospital Puducherry. And now after this training in Puducherry and after training in Hindupur, whole of the South India have launched training courses involving those trainers which we have trained in those places. In Puducherry, they have done more than 15 training courses so far. Then I went to Bhutan and I trained these guys in Bhutan who are national trainers. They wanted me for Bhutan for 1 year, just to conduct training courses all over Bhutan, but I was not available for 1 year. 15 days training course in so many places round the year, it's a very challenging task. Then we have in Sri Lanka, this is the second training course in Sri Lanka. You see, after the first training course in Sri Lanka, all hospitals in Sri Lanka, they were having antenatal education. All hospitals have breastfeeding counseling people, counselors in breastfeeding in every hospital, and Sri Lanka has more than 90% initiation of breastfeeding within 1 hour. So all those countries where we have done trainings, they are doing marvelous job. I did one training course in Indonesia, then in China, I have done one training course in China, and then we have done in various parts of India. Say in Kashmir, we have done 2 training courses, and we have done 1 training course in Simla. Apart from this, we are doing some counselors training courses for 7 days, and we are doing trainings. Let us now talk to you about this community project, where I thought that whatever I am training, let us see that whether it has impact in communities or not. So I went to Lalitpur, because Lalitpur is the most backward district in UP. The infant mortality rate in 2006, when this project was allotted to me, was 81 per 1,000 live births. 81 per 1,000 live births. So then I moved there. I trained graduates from Lalitpur. I just selected 48 graduates from all the blocks, 6 blocks of Lalitpur. You see, the key to breastfeeding practices is continued day-to-day support for breastfeeding mothers within her home and in community, not just in hospital. So I trained those graduates from there, and you see these 6 blocks I have been. I conducted 2 weeks training courses for those graduates for 3 times. After this training, they were involved in training of community workers. We have more than 30,000 workers trained in all villages in Lalitpur. And these were not only trained, we assigned them a mother support group in each village. Mother support group in each village means there was 1 ASA, 1 Anganwadi worker, and 1 woman from the village who was interested in counseling after sensitization and training. These mothers, these workers, they were settled in the villages, they were coming to blocks for reorientation, they were going in villages. So it was continuous training, monitoring, and observing mothers and babies in the villages. And you see, they were creating awareness. We have these teams. So ultimately, you see, we have more than 30,000 and more than 1,200 centers in Lalitpur. Those were mother support groups in villages. Let me just go to what happened when they started working in the villages. You see, these were all skilled trainers, and they have opened their mother support groups in different villages. So, more than 90,000 babies, they are exclusively breastfed in Lalitpur district between 2007 to 2012. If one wants to do research, as Dr. Satish was saying, those cohorts of 90,000 exclusively breastfed babies will be a good cohort to study what is happening to hypertension to them, what is happening to diabetes to them, what is happening to allergies to them. All those illnesses can be studied in that, in those cohorts. Then we first time introduced WHO growth standards in Lalitpur, and we followed that. What has happened to Lalitpur children? You see, undernutrition has come down drastically. The infant mortality rate in 2011 came down to 40 from 81. None of the measures can bring down this drastic change in infant mortality rate. None of the measures, all immunization and all services, all NICUs, they will not bring the mortality to this low level. Then you see the this was milk supply sufficiency and self-stopping breastfeed by the baby. 65% mothers, they said that the baby stops after a feed, and you see the healthy ratio of healthy babies, perception of healthy babies have gone to 80.5% from 47 to 1%. So this was a project which was a dream project. I tried to copy this project in other districts also. So these are the mothers you see from Lalitpur villages. And just to show you that this type of breast condition, many of you can just diagnose this breast condition. What do you see on the top? It is mastitis after engorgement. And those mothers in the villages, they were able to manage this mother, and she was beautifully breastfeeding later. You see, there were so many stories from the Lalitpur. I cannot just go ahead in such a short time, but just to tell you about that protection, promotion and support to breastfeeding requires strong national and state policy, sensitization of policy makers, administrators, and training of all health workers in MCH services, and deployment of trained breastfeeding counselors in obstetrics, pediatrics, and SNCUs and NRCs. After Lalitpur, I had a very good district magistrate in Gorakhpur, and he was so much influenced with training in Lalitpur that he said that let us train all health workers in Gorakhpur, and then wherever he went, we started training courses. So in UP we have 8 districts where we have conducted training. In Bihar, in 3 districts we have conducted training. In Hindupur, after training, we have 1 district, Medak district, where we have done training of all Anganwadi workers and community workers in Medak district. In Medak also, the infant mortality rate has come down from 60 to 40 within 3 years of intervention of this project. So we have been to so many districts. After this, I also thought of training medical graduates. So I devised a module to train faculty members of pediatrics, obstetrics, and gynetics, and we started training course in medical colleges. So in 13 medical colleges in UP, We have now trained faculty members. We can impart training in medical colleges. Then I talked to our beloved Chief Secretary at that time of UP, and he agreed to deploy counselors, breastfeeding counselors in NICUs, in SNCUs, in NRCs. So at that time, when I was in job in 2012, I have 12 counselors deployed in my nursery, in newborn unit. 12 counselors, breastfeeding counselors. And now the government has made a policy that government is giving job to breastfeeding counselors in NICUs. Now let us come to purpose of this oration. The purpose of this oration is, as a pediatrician, you can make sure that mothers and babies are kept together after birth unless medically indicated. Mothers and babies kept together unless medically indicated. We need to inculcate to take a breastfeeding and complementary feeding history into our day-to-day practice. Let us ask how you are feeding your baby. What you are feeding your baby. If mother has an issue with the feeding, or if the baby is not growing, we must assess and observe a breastfeed before suggesting and providing help. In the skit today, you see that a counselor, a beautiful counselor, was just giving advice and suggestions without observing how breastfeeding is going on. So first, observe a breastfeed. How many of you are equipped to observe a breastfeed? Observing a breastfeed will take 6 to 10 minutes to just see that how mother is breastfeeding, how mother is sitting, how she is holding the baby, how she is offering her breast to the baby, whether she is bringing the baby to the breast, or whether she is putting the breast in the baby's mouth, how the baby is attached, how baby is suckling, how baby is finishing the breast, how mother is finishing the breast. So all these things you must learn to observe, and once you have found a difficulty, then only you have to help the mother. Then you have to support that mother. If there is no difficulty, no help is required. We must learn to help babies and mother in extremely difficult situations like low birth weight babies, hypoglycemic babies, babies born from HIV positive mothers, babies with HIE, and babies born with congenital defects and metabolic disorders. When mothers want to relactate, we have to help them. So you see that this is what we have to think about, that we alone cannot work unless we have a policy, we have a support from government, we have support from administrators, and we have a hospital, we have institution, we have community, all linked together, and we all are working together. Luckily in Andhra Pradesh, 1 year back, we got a call that Andhra Pradesh is going to train all its health hospitals to make baby friendly. And we have trainers training to train health workers from all government hospitals, and we did that. So we did that with the help of Keshu Allu and doctors here. So in Andhra Pradesh, Telangana, it's a Telangana, okay, Telangana, we have done this training, okay. Okay. So you see, we all must know the recommendation on IYCF, that exclusive breastfeeding for 6 months and thereafter breastfeeding along with complementary feed for 2 to 3 years, not 2 years and beyond, for 2 to 3 years. Then antenatal education of all pregnant mothers and their families, and signs of breastfeeding and risk of artificial feeding, HIV and infant feeding antenatally. So there should be 2 classes of antenatal mothers, their families. All of us must make sure wherever we are working, talk to antenatal mothers, about advantages of breastfeeding, about disadvantages of artificial feeding, about what happens immediately at birth, skin to skin, how baby latches, how baby stimulates prolactin, how baby stimulates oxytocin, what difficulties can happen. If you initiate breastfeeding immediately after birth, immediate and continuous skin to skin, breastfeeding difficulties will not be seen. If you delay initiation, if you put the baby in NICU for observation, the breastfeeding will not be established well. So we have to just talk to mother. Skin to skin and breastfeeding, expression of breastfeeding, Katori feeding, breast conditions, you all know barriers to breastfeeding and building mother's confidence. It's very important to build mother's confidence. Even if the mother is artificially feeding, not to criticize a mother. Being critical in a mother undermines her confidence. In the skit we said, you saw that health worker was saying that you have to breastfeed. You are not doing good job. You are not. We are not to say that you are not doing good job. Nowhere we have to say. She is doing best what she knows. We have to now empower her to decide what is best for her. Then managing difficult situations and fostering mother support groups. Mother support groups, I think Sushena, you see, they are doing such a marvelous work, wonderful work here. They could lead in Telangana to establish mother support group in each villages. It's such a pious work. If you just establish mother support group in hospitals and in villages, you will be saving millions and millions of babies in 10 years, 12 years. Right now, if India follows all these things, we can save 1 lakh babies each year. Then fostering, monitoring and recording feeding status and age and reporting is very important. Then you see that this is skin to skin. People say, and obstetricians say, that the OT table is very small. OT table is not so small, where a baby cannot be kept on mother's bare chest. So immediately baby can be kept on mother's chest, and all of we must learn how to teach mothers about expression, about positioning, and this attachment and positioning we all have to know. And you all since morning and since yesterday you are doing the classes, you can recognize which one is good position and which one is poor position. Which one is good attachment in this figure? Good. And you see, what about this? This is little difficult. Can anyone say about this attachment? Anyone? That's good. You see, it appears good attachment, but when you go closely, the lower lip has gone inside. So the good counselor must observe what is wrong, and then they have to. And the different positions, like for small tiny babies, this position, under football hold position or underarm position. This is feeding across an opposite side. So we all learned these different positions. This is in NICU, see, we have to ask mothers to sit together to express breast milk and to feed the babies with katori or palade here. And then we have to, all of us, we have to pledge from today that we have to assess a breastfeed. We have to praise a mother and baby, whatever you have found good. Even if the baby is very sick, mother has been doing something good, baby is surviving. So we have to recognize what good she has been doing. We have to praise that. And then we have to support mothers in what they are doing. If you are a surgeon, you get a chance to see a mother with engorged breast, blocked duct, or mastitis or breast abscess, you may call a trained counselor and take her opinion before incising a breast abscess. As an obstetrician, you should initiate or improve antenatal classes for expecting mothers and their families, and use I Decide app of VPNI. VPNI has a I Decide app which is available even free of cost. You can download and give to the mothers to train antenatally. At birth, if the baby is term baby, is crying and breathing and has good muscle tone, you may put the baby at mother's bare chest, and drying and clearing of the mouth and nose can be done there for by resuscitator. This immediate skin to skin should be continuous at least for 1 hour. Instead of asking, have you fed, as you have seen in the skit, that are you breastfeeding? Instead of asking this question, how breastfeeding is going on should be the question. So how breastfeeding is going on, make your facility comply with BFHI. If you are a counselor, you can be the key person to impart antenatal education, immediate and uninterrupted skin to skin, help mothers to learn feeding technique, expression of milk, cup feeding or katori feeding or palade feeding, and if needed, help mothers in feeding difficulties. We should always be available to breastfeeding mothers. If you are support staff in case of mothers queries, you may refer her to counselors. All of you should be familiar with science of milk production and supply, and recognizing difficulties in breastfeeding early, and providing dedicated help, and knowing myths, breast conditions interfering, adequate feeding, causes of crying and refusal of feeding, and helping mothers and babies in these situations. All of you and hospital administration can help make facility baby friendly. So please make hospitals baby friendly. Working together, let us explore how we can turn the tide, foster support, ensure that every mother can embrace confidently her role to nurture her baby through breastfeeding. If you are a policy maker, make breastfeeding as a standard care in all academic recommendation. Standard of care. Breastfeeding is a standard of care of babies, of mothers. Together we can train multiple disciplines, all MCH staff, all faculties in medical colleges, nursing colleges, home science department, nutrition department, allied health professionals. We can establish a new professional, IYCF counselor, breastfeeding counselor. We can foster mother support groups in community. And we can monitor IMS Act. Wherever there is violation, please report to Sushena Foundation and BPNI. Let me conclude. Let us remember that breastfeeding is not merely a choice. It is a fundamental right for both mothers and their infants. It is our collective responsibility to create an environment where every mother feels supported, equipped to nurture her baby through breastfeeding. Together we can break the barriers that stand in the way of this vital practice and cultivate a culture that celebrates the priorities and prioritizes breastfeeding. I urge each of you today to champion this standard practice and to educate and support mothers, to train colleagues, fellows, and other professionals. Remember, we all should say loudly, healthier future begins with breastfeeding. Healthier future, just say, healthier future begins with breastfeeding. Thank you.
We request our National Health Mission Director, Shri Kannanji, also to please come on to the dais. May I also call upon Dr. Zalalim, the UNICEF Chief, please come on to the dais. A big round of applause for both the gentlemen. May I also call upon to the dais the Vice Chancellor of Rishihood University, Dr. Shobit Mathurji. Also, may I call upon to the dais Dr. Durga Prasadji, the advisor to Sushena Health Foundation, and chief patron of Sushena Health Foundation. Big round of applause for him. May I also call upon to the dais Kiranji, one of the patrons and founding advisors of Sushena Health Foundation. They have incubated us. Big round of applause for Kiranji. Come all the way from Delhi. Yeah. So over to the felicitation. Yeah. Please, sir, please join us.
With reverence and honor, we would invite Dr. Tejo Pratap Oleti, Dr. Sriram Subramaniam to felicitate Dr. Kushwaha ji with shawl.
Yeah. Sriram Subramaniam.
Dr. Tejo Oleti, Dr. Sriram Subramaniam to felicitate Dr. Kushwaha with shawl.
A big round of applause.
Please give them a big round of applause.
Big round of
Your
applause.
cheers are all that we require. To give away the citation, I would now request Dr. Bhavani and Dr. Lakshmi Ved Prakash to give away the citation.
Big round of applause.
We now request them to give away the silver plaque. Let's keep the big round of applause going.